So this panel is When Systems Fail, Rebuilding Trust. I think, again, we've seen this theme of trust really come up today throughout this conversation, but I think, again, it's been a recurring theme that we've seen at this summit for the last couple of years. Trust is one of the issues that I think has most faltered in the way that we deal with institutions, political parties, policymaking. So really looking forward to this conversation and what our panelists are going to bring. So joining us now, we have Meaghan Thumath from UBC and Lalitha Flach of Elections Ontario for a conversation on moving forward when people lose trust in our systems. They'll share their sectoral experience and explore how to rebuild that trust. Our moderator for this session is Dr. Andrea Lawlor from McMaster University. Dr. Lawlor is an associate professor in the Department of Political Science and the Public Policy Digital Society program at McMaster University, specializing in the study of Canadian public policy, public opinion, as well as administrative and election law, including the third-party regulation in Canadian federal elections. So something that I think has been really interesting lately and always comes into a political financing discussion. Dr. Lawlor's work has appeared in the Canadian Journal of Political Science, the Canadian Journal of Law and Society, and the Journal of Social Policy, among other channels. Dr. Lawlor holds a PhD from McGill University in Political Science and a PhD in Law from Western University. Welcome, and I'm excited for this conversation.
Thank you so much. I am delighted to be here this afternoon with my two fellow panelists. As already expressed, we have Meaghan Thumath, who is a registered nurse and clinical assistant professor at University of British Columbia. She is also a public health officer with the World Health Organization. And Lalitha Flach, who I think everyone knows is the Deputy CEO at Elections Ontario, and before that she served in multiple roles in elections administration, including the COO and Director of Operations and Communications. And our conversation today focuses on this theme of trust that has already been, I think, the product of some really generative conversation in these sessions. And trust is often described as a sort of phenomenon that is failing, a system that is failing across Western liberal democracies like Canada and the US. But I think what we're going to get into today is how that high-level story doesn't always reflect the variability that we see, whether that's geographic or across political institutions. So when we prepped for this session, we agreed that I would set the table, so to speak. And I don't see the clicker here at the moment, but if we do have some data to show from our friends at the Canadian Election Study and our CDEM partners that reflects the last 25 years in trends of trust over time. And these trends of trust have a couple of really interesting features, I think, that we can elaborate on in our discussion. So, thank you. What we're looking at today is what do we know about trust in government institutions, not just the federal government, not just partisan government. What explains these evaluations of trust, and what are the underlying dimensions of trust that we need to be attentive to if we want to have a serious conversation about how to fix any gaps in trust. So, as I mentioned, just by way of a little scene setting, we've got about 25 years of high-quality data from nationally representative population across Canada in terms of their confidence in various political institutions. And in that top row, starting from the top left, we have trust in the federal government, which, as you can imagine, gets a little bit variable with partisan trends factoring into assessments of trust in the federal government. But what we see in general is that Canadians still consistently report high levels of trust or confidence in their political institutions, ranging from the civil service, courts, election management bodies, even organizations like the police and the Canadian Armed Forces, which have seen their fair share of scrutiny in the last few years. Canadians are generally trusting in their institutions of government. Where we see perhaps some limitations in this might be in their trust in some civil society institutions, including media, businesses, and unions, amongst others. But I think what this lays the foundation for is an important set of discussions around a few themes or sub-themes in trust. And those include the fact that we don't really have a strong uniform dimension or definition for trust that we all share. We all have this different sense of what does it mean to trust an institution. The second is, do we need to start thinking about those dimensions of trust? And I think Lalitha and I will get into this conversation as well, how we can do a better job of asking citizens about their assessments of trust. And then finally, does trust change over time? Or if you are a trusting person, do you tend to remain so throughout your life cycle? So we'll pick up on some of these themes, and perhaps to get us going, I'll point out that both of your work in your respective sectors, trust is really foundational. So Lalitha, from your perspective and your experience in elections administration, what does it take to build and sustain public trust? And how would you define trust in practice as somebody who administers elections?
Thank you. Is this good? If I have to push a button, it's not going to work out. So we do take our role really seriously, of course, and we are stewards of democracy. And although we are not the only ones in that ecosystem, we measure, ourselves in terms of whenever we do anything, any work we do, whether modernizing or, tried and true processes, we always use the fundamental principles of transparency, one vote per voter, secrecy of the ballot, a fair and level playing field, and integrity. And those are the markers of how we create our processes so that people have a good understanding of what that looks like. And you talk about defining what trust is. And I think we've had a lot of conversations in our institution about what does that mean. In the past, we used to ask a survey question about confidence. And people would say, yes, I'm really confident in the election that Elections Ontario did. We have a 84% score in 2022. But when we're looking at, well, what does that confidence mean? Like, what are you confident in? There's varying aspects of what that looks like. So this time we decided to, really expand that concept of trust and break it down into an index. So we have 9 measures. So I can't remember them all, so I'm gonna just look. So integrity is one. So in asking questions to people about what do you think Elections Ontario has integrity in how they do their systems, what they do? Excess accuracy. So for us, one of our big markers is the results, right? You want to know that we're accurate in how we produce the results, no matter what mechanism we use. Transparency is another one. What does that process look like? We take a complex piece of legislation that half the time I have to read 6 times to really understand what is being said and break it down for people so that every day people can come in and vote easily. Transparency and fairness. Fairness that that's the level playing field. We don't care, like we say in elections, we don't care who wins an election, we just want wide margins. So we don't have to do a recount, although I have to say the 2 recounts we did, I thoroughly enjoyed. Efficiency, reliability, accessibility, or accountability, are all huge aspects, and responsiveness to elections. So if we measure all of those things for ourselves, we could say, yeah, we are like those, that's our work. So it's not just trust, it's all of those pieces of it.
Thank you. And Meaghan, maybe I'll ask you to pick up on this discussion and to use one of the most overused words in 2025. I'll ask us to pivot from elections to health, and where health is obviously a field or a sector that has experienced tremendous pressures in the last 5 years, arguably for long before that too. So in your opinion, what can we do to better earn the public's trust? Or how do we know when it's been earned or lost? That dynamism of trust that comes into play when we talk about the way that citizens relate to their healthcare system and they receive services from their healthcare system.
Thanks for that. As someone that is a public health nurse and has had to work sort of really at that cool face of engagement with public health, I've had a few people ask me, like, oh, what are you doing here? What does this have to do with political institutions and democracy? But, population and public health is inherently political. And so, the conditions that really shape communities' health, whether that's housing, education, income, food security, they're all shaped by the political decisions and political actors, and the really functioning democracy really is needed for strong public health. So it's sort of, there's very few public health people that you'll meet that are not also have side hustles in various political engagements strategies. So it's something very natural for us, and I think we see our results really immediately, which is like people turning up for vaccines or not. We see it in measles outbreaks that have gone out of control. We see it in convoys, et cetera. And how do we earn it back after we've lost it? I think that's a really emerging area. I mean, public health scholars for many years have worked on. They've called it just different things than disinformation and misinformation. But as someone that's been working, I've worked at the World Health Organization for many years and the Red Cross, and I've deployed to primarily my area's outbreaks. So Haiti, Ukraine, DRC, South Sudan, I'm kind of at about 26 countries. And it kind of hit me coming back from the Ebola outbreak in Congo when I transitioned to COVID. It was the first time I found myself sort of scraping the logo off my vaccine van in Canada. That was something we did all the time in the Congo. We would have on our radio, like, today is a day to wear our visibilité, our WHO vest, and today is a day to take it off. We were constantly listening to the community. We were doing a lot of social listening because the violence was so close to our work. And it was really kind of somewhat shocking to my colleagues. I think those of us who did global public health work, we were like, okay, now this is happening at home. And so we really took a lot of the strategies that we had learned from the Global South. I'm a big believer in sort of these partnerships between countries because I think there are so many lessons to be learned. And that's one of the things I've loved as being part of the Red Cross and Red Crescent movement and WHO, that actually other countries have been struggling with this for many years, and those are the solutions for me really lie in like getting hyper-local, doing what we call social listening, and doing that in a way that's utilizing AI and machine learning at scale, and then understanding what are the myths that maybe have a grain of truth in them, which we call misinformation, and how can we use information to sort of answer those and do corrective action, and then what's actually disinformation that's being spread intentionally by bad actors. So yeah, look forward to chatting about that more.
And maybe I'll pick up on this theme of the importance of the local dimension when it comes to building trust and retaining trust. So we often see that people express higher levels of trust or confidence in their local institutions than they may do at the national level. So why do you think that is, and what does that tell us about how trust is formed and can be sustained? And if you have recommendations or policy suggestions, what might those be in order to help bolster the strength of those local expressions of our public institutions?
So in Ontario, we have 124 electoral districts, and each one we have local election workers on the ground run by returning officers. And we employ about 55,000 people across Ontario. So that's a local spread right there. And part of that is to have that local flavor of people who know the community, understand, like you're hiring 600 to 700 people in the local community. So that's, again, I think Stephen asked a question about, being in a small jurisdiction, how do you get that word out? This is part and parcel of the people who are fundamentally connected to the process. They're excited to work in elections, and that's part and parcel of local. Now, that's one aspect of it. We also, in the ecosystem, have political entities. We have, Greg's going to correct me, but probably 25, 26 political parties in Ontario, which most people don't know because they only think there's 4. And so that's a network of people, of candidates out there. We have like 800 or 900 candidates in Ontario. Like this an election, although we're one institution that does the administration, there's many people. And we also work with NGOs, outreach. We work in outreach. We want to work with people on the ground in different institutions, Indigenous groups, libraries, lots of local institutions. Now that I have your name, I'm going to connect with you, Meaghan, in Ontario in healthcare, because we work in hospitals, we work everywhere. So from building that trust, if they know that our process is reliable, we're coming in to engage and to ask people to participate, that to me is really building it, because it's really explaining the process, because I think that's a lot of what people don't know. And I'm sure in healthcare it's the same thing. People are scared, they don't know, they don't want to hear from some person out on a box that's, you know, this is important, here's the science, etc. They want to know that, like, I've said this is an important thing, I'm going to do it. We heard Dr. Hunt talks about that today, that somebody that you trust is going to tell you to do something, you might listen to it. So the more our ecosystem, we're not the only ones at the table, like our trust score should be everybody's, like it should be all these different institutions and groups getting tested on that.
Yeah, I mean, I'll come in and say it's so fascinating to me. Like, I love these multi-sectoral kind of opportunities to talk about public policy, because like the what you described, you know, there's the chief electoral officer, and I think of that equivalent for us as our chief public health officer, you know, both nationally and provincially, or sometimes called our chief MHO or medical health officer, and we have that, just that sort of level down as well. We have, you know, all of you have local medical health officers or PHOs in yours, and there's local public health nurses. And I think one of the trends that scares me in public health emergencies is we tend to go right into command and control kind of leadership and command and control comms. And I think that can also happen during an election, especially when we have really short snap time, or during a crisis in public policy, whether it's, you know, around resources or tariffs, et cetera. And that tendency to kind of command and control the message and the narrative is, I think, what's really breaking down trust. So the example I'd give for us is, like, we're often not allowed to talk about, I'm not even allowed to be on this panel. So, like, if you Google me, I'm incognito. I'm not a, you know, I'm here with my academic hat for a reason, because you're really not allowed to speak freely when you work in many of these sort of even crown corporations closely tied to government. And I think it's such a mistake, because people trust, everyone knows this, everyone trusts their local officials. And so I'm really inspired by kind of collective impact models and networks where we can really figure out what our key messages are and then distribute them. And that's, I've seen that work super well. Like the mpox outbreak was something that worked really, really well. A lot of us had worked in the HIV movement for many years. We understood that, you know, I'm a white settler, heterosexual woman. The gay community does not necessarily want to hear from me about how to prevent mpox, and we were able to get clearance early to have influencers from the gay community and the trans and two-spirited community go out and say, get your vaccine. And we got local people to get the vaccine from community. We went out and we mobilized our old aid service organizations to do vaccines in parks and go to community. I picked up my vaccine, hadn't done it for a while, and went into gay bars, and people were so thrilled that we were there. They were grateful, and they trusted us because they knew us. We were their local, whether it's public health nurses or their local doctors from the community. And what is that equivalent in elections or in political organizing? You know, there's a reason, if you've ever worked a campaign, everyone's like, what can I do? And it's not glamorous, but it's go knock doors. And there's a reason. Like, there is no substitute to that local grassroots organizing. There's a reason pharmaceutical companies that are billionaires continue to invest in pharma reps who are knocking on the door of the local doctor's office, because it's effective. And how can we sort of translate that at the local level and in our bigger policy institutions? And how can we kind of avoid that impulse we have to command and control, whether it's in Premier's office or Prime Minister's offices? We've got to kind of keep letting people work in their local communities.
I think, though, if I may, that I think it's a balance between the two, because, you know, while we have that many people out there and we have very many people in our ecosystem, it's up to us as the administrator to ensure that everybody has the proper information, that we are actually controlling that piece of it, because, you know, they don't work in elections 24/7, and a lot of the answers they may give they may not know it correctly. Mistakes happen, and we need to make sure that we do our due diligence in the right training and that kind of thing. But ultimately, we're responsible, and this is the big balance and the big challenge: is that while we have that network out there, we are accountable, and your question about we're responsible for trust in elections is really like, I feel like we're one aspect of trust in elections. We are not the only ones that are participation in here. But when things go wrong, everybody looks to the administrator to say, what did you just do to wreck that trust in elections?
I think this leads really nicely into a conversation we've been having, and that so many institutions rely on whether it's voters or people seeking out health services in order to build up those relationships. It's very much between practitioner and their clientele or their audience. But on the opposite end of the spectrum, we might think about ways in which the mandates of the institutions might be enlarged or changed or altered in order to better serve these missions. Are there ways that you can think of that might be helpful or may assist in allowing elections administrators or public health officials better reach target populations by making some changes at the top, whether it's more resources, more human resources, or greater types of authority that you have in your mandate?
Well, to me, it's really understanding what our mandate is. And I think ours is pretty clear. Like, we are responsible for ensuring that people know where, when, and how to vote. Okay, so that is clear to us in terms of what our mandate is, and we are building modern services that put the needs of the elector first. Would I like more resources? Always. That is not always possible, but understanding a clear mandate is important. Our political entities in our trust index actually trust Elections Ontario. 88% of them trust Elections Ontario. I say that's pretty darn good, because you look south of the border to the US, where they were talking about our friends across the border. I feel terrible for them, because they are also working as hard as we are in this business, and the results of the elections are combated. But it's not true, it's not right, this is not, they're not accurate, they're not reliable. And so that fundamentally comes up to the borders, to north of us. So election administrators over the last couple of years, where they were almost like, the independent officers were really always trusted, nobody ever kind of sanctioned, but now that's starting to be called into question in terms of what they do. But a mistake happens, and suddenly the entire system is at risk, when that's not entirely accurate.
And I think it really highlights just how much of these systems are built and based on norms that we've shared, whether across the province or across the country. Norms of not attacking independent bodies, or norms of conducting oneself in a particular way in order to facilitate the strength of the institution. And when we get people who are willing to push the boundaries on those norms and say, well, I saw this work elsewhere, so maybe if I try this strategy, it's going to provide some sort of short-term benefit to me, but often not thinking about the medium or longer-term benefit on the systems. Right. So it's that there's an institutional mandate piece, and there's also a sort of political and social norms piece that's a lot harder to deal with in policy contexts.
Look, our legislation has been around in the same vein since the 50s. Our world does not look the same. So, we have to change with that, but we don't make the laws.
Yeah, I mean, for me, like you asked also, the question around rethinking our kind of institutional mandates. And again, I go back to this importance of these multi-sectoral conversations, and for us to be learning from each other. And one thing that's maybe not as well understood anymore is that, like, communications and sort of behavior change scientists are like probably the biggest growing sort of field in public health, and even in many of fields of medicine now. And like, when I'm in the field, we have built a new pillar. It's called risk communication and community engagement. and RCCE for short, and it's kind of like public health people that think they invented community mobilization. But they're taking tactics that everybody in this room has used for many decades to be able to like mobilize people to say get a vaccine. And it took public health people, I think, quite a long time to realize that people don't just do what we say because we told them, and that we really needed to understand what are the barriers to participation and what are the facilitators. And that's not a really great ad campaign. It's actually, is it easy for me to do this? Like if I have many jobs and I'm low wage employer and I'm gig economy and I'm going from place to place and I've got to get my kids to school, can I drop in and get a vaccine really easily, or do I have to make an appointment on a device that I don't have, that's not affordable to me? And really understanding like what are those sort of design thinking barriers to participation, and I think we apply those same things, I hope, to voting and to being able to participate in democracy or to participate in policy making. It's like, how do we make it easy for people? And then how do we also really think from an equity lens how things like access to vaccine information is interpreted if you are from a racialized community where public health has really earned your distrust. And I say that intentionally, like the Alabama experiments against the Black community where we let people go untreated for syphilis for many, many years. And that was a true scientific trial experiment where people wanted to understand the natural course of syphilis, and they let people not get access to Bicillin, a treatment that was free and accessible to everyone else. Whether you're from a small First Nations community, and public health nurses were involved in making sure your children went to residential school, again, like absolutely earned mistrust. And so I think having that naivete, sometimes I have like, why aren't people coming to the clinic? And it's like, well, the clinic isn't a safe space for everyone. And that's why we really have to go back and work with local community ambassadors, work with First Nations leaders, work to really understand what is it that we can do to make this a safe space for you, because we have not earned your trust. And I think that frankly needs applied to like all public policy spaces.
Well, there's so many barriers, right? Like 35% of eligible electors in Ontario believe that we couldn't do anything to change their mind to vote, like whatever. So then that makes me think, well, why? Like, what is that? So we know, to your point about barriers for marginalized communities, and looking at the barriers specifically, ID is a huge barrier. Accessible locations, all sorts of, like, there's quite a number of barriers, and we often try to take it all away. Like every election worker I know across the country, administrators will work like yeoman's work to reduce as many barriers, but then there are just some that are beyond our control or we run out of time. And so that is something, listening to what you're talking about for healthcare, I think, to me, some of the change for the future could be institutions working together, because if we reduce the barrier for ID, and everybody has an accessible piece of ID that can be used to vote, that can be used to do something else, that we can use to do something else, that's a barrier we don't have to deal with. If every location was accessible when it was being built, then we don't have that, because we don't own facilities, but we need to use them as voting locations. If every worker was trained and understood how to treat each other, we wouldn't have that barrier. So that's on an ongoing basis across communities. That would certainly help in some of these pieces.
I think it's becoming apparent that there are problems that we can legislate away, but those problems are becoming fewer and further between. And some of the most complex issues around public health and elections engagement are those sorts of problems that we can't simply just pass a new bill in order to alleviate the problem associated with it. So whether it's misinformation, disinformation, digital harms, technology makes these problems more prevalent, and it may have some solutions to offer too. But increasingly, when we're looking at a situation where the answer to the problem is not simply waving the pen at it, how do institutions like the ones that you are a part of respond to those very serious concerns that citizens are experiencing and often don't have a lot of guidance in order to deal with?
Yeah, I mean, I think it's going back to a little bit what I was saying there around like addressing what really is the challenge for people. Like I think back to one of the most powerful lessons I ever had was the Ebola outbreak in Congo, and really trying to it wasn't until we stopped to actually listen to communities to understand why they weren't coming to the Ebola treatment center, why there was, rocks being thrown at our cars when we drove past, our treatment centers were being burned, and we were like, well, we're here to help. Like, why are we experiencing violence? And it was actually the anthropologists on the team and the communicators who were like, let's leave it with us. Like, we're going to go to the local, literally little local pub and listen to people and talk to people and figure out what's going on. And local people told us, well, you're stealing our organs. And we're like, well, what? And then we realized because it was early days of the outbreak, and people had been coming to us really late stage because they were afraid, because we rocked up in these white outfits from space with like all these masks. And think of like the early days of PPE, but in Ebola, the PPE is actually more extreme, and it really does look like you're wearing a spacesuit. And we rocked into communities and built these big centers in jungles in the middle of nowhere with a whole bunch of trucks and a bunch of like security apparatus. And we set up these giant tents, and people went in and they came out in coffins. And so people were smart to not trust us. We didn't hire locals. We came in as like mainly non-foreigners, and we didn't explain to them what we were doing. And then we found out that one of the most risky parts of Ebola is local burial practices, because when you're cleaning and washing a corpse is really viremic. And so you're really able to, that's the most dangerous thing. So then we outlawed burials, and we started taking people's loved ones that had died from their communities, and with really overproportionate force, like wrestling them away from their family and saying you can't touch them. Well, what's most sacred if you think of, yourself and your community? Like, the ability to mourn and to bury your loved ones in a safe and dignified way is a cornerstone of grief. If anyone lives through the COVID pandemic and lost anyone during COVID, and you didn't get to have like your whatever your local rituals are, that really impacts people's bereavement. And so when we stopped and really thought about it and started working with local partners who were like, you know what, fine, we get it. We explained why we were doing it this way. And they said, let's involve us in the process. And so we started to work with local faith-based leaders, elders, and others, and trained them in PPE and started training them. And we literally handed them shovels and we're like, let's build a safe grave together, and let's do these funeral in the right way, and let's bring all the rights that you want back, like other than the body. If you need to wash the body, sure, let's give you PPE, and let's give you like back your songs and all of the things that you want to do. And so like that lesson sits with me all the time when we've lost trust with local community. I think like, stop, listen, let's find out what that grain of truth is to local people and what's important to them, and then let's see if there's a way we can change it. I mean, we just did it in the fire response in British Columbia. We were struggling because local members, there was rumors going around, disinformation and misinformation probably, that we were trying to take people's property, or that we were that we were trying to make the local bridge burn down. And so when we brought folks who had been part of these same disinformation networks online, spreading through like fire through WhatsApp groups, we brought them together and we said, why don't you join the local fire brigade? Why don't you grab, a fire hat, and we'll give you a bit of rapid training, and like, let's break bread together, let's eat, and let's realize that these local these fire officials who've been flown in are people you can trust. And we brought the biggest dissenters into the fire response. And that, I think we can apply those lessons to many different crises.
Yeah, I think for elections, I go back to our trust index. What we really need to do is when we see levels go a little below, we need to be able to take a pause and look at introspectively to say, how do we improve this process that we're doing, and be really mindful about what it is and how we're doing it. In our recent election, because it came really quickly, 1 in 4 Ontarians felt that we weren't impartial because we called the election. So that is like a clear indication that really don't understand the process. So we have to really pause to try to explain what Elections Canada did in terms of myth busting, right? To really, and be that authoritative voice so that they come back to us to say, we don't know. In the snowstorm, as Greg mentioned earlier today in his presentation, we had voter information cards that didn't get to people on time, et cetera, but we've got a digital solution already. It's for us to start looking at different ways of communicating with different people, different demographics, et cetera. We have a young population. This is TMU. We've worked with them. We've worked with McMaster University before, and we were trying to work. We had a plan for a year to work with many institutions to challenge them to work and put a poll on campus. And McMaster actually took us up on that and actually staffed a poll. And so when the students are working, now they're like, hey, well, now I can vote. Like, I understand this process. I trust it. I am going to, and this is that movement we have to see. Like, we talk about things going viral on YouTube. Well, this is the kind of thing that we need to make it go viral. That once they start to participate, those barriers or perceived barriers, it can go down.
What I find so refreshing about both of these responses is that they're so centered in engagement. And I think so often our policy responses of 25 years ago, when we were faced with these sorts of challenges, the first word out of everyone's mouth was, well, education. We need more education. And certainly I'm not going to be a professor who sits here and says we don't need to educate our youth, our populations in general. But to me, this is the baseline. This isn't the policy aim. The baseline is that we have strong programs in our schools and that we have strong educational resources becoming available from our institutions, but that where the rubber hits the road is really in the engagement piece. So it is in the inclusion of people in whether it's public health processes or getting students to actually staff those polls on campus. Right. And having spoken to some of those students, the pride that they have, the sense of ownership over their own democratic process. Right. Is you've not only created lifelong voters, you've created lifelong, exactly, advocates for democracy. And so it makes a difference.
And I think one of the things that we have to do better is that we have to keep it going all the time. And, not just as we lead up to an election or when there's an election or whenever, because people are like, well, what is an election relevant? But now that elections are just happening 24/7 all over the place, it feels like we should be out there all the time getting people, and that means more funding. I'm saying it publicly. See, my boss is sitting right there.
Fantastic. Well, I think the story that I'm increasingly hearing, despite the fact that there are from some quarters we would think the sky is falling when it comes to trust in public institutions, is actually a much more optimistic story. That we have reasonably high levels of trust in our institutions of government. We have reasonably high levels of trust, and while we don't have levels, as you suggested, of we might have 80% trusting, that in and of itself is a real success story. So it's important for us to celebrate these successes as much as we do continue to reflect on the necessity of strengthening trust in our institutions and maintaining the resilience of those institutions to external attacks, whether they're domestic, foreign, or whether intentional, or whether they're just sort of the byproduct of public conversation. So I'd ask you if you had one or two lessons or habits that you have seen as successful in your field that you believe other sectors could adopt to help restore public trust, or help, I won't say restore, but help to maintain public trust, and especially public trust in 2025, where we are constantly facing the onslaught of information, and a lot of us have sort of informational and social media fatigue. How do we still get through to people in order to enhance that trust?
I mean, for me, I think, and it echoes to some of what we've been hearing from others, is sort of this idea of radical transparency. And it's funny because I had it in my notes. It was said earlier today, tell people the truth, but also tell them what you don't know. And that I found so helpful during the pandemic again. And science itself is an iterative process. If a scientist tells you that they know the answer to something, they're not really a scientist. The idea is that we're continually uncovering new truths. And so when I think back to the pandemic and the disinformation that was spreading, I think it was challenging for a lot of scientists to understand, because they were like, of course we didn't know exactly. It was an emerging pathogen, so of course our advice changed as we got more information. And I think it just taught us again that like science literacy was quite low if people really didn't understand that. And so more and more these ideas of like, inoculating the public against disinformation and misinformation is educating them, things like the SIF methodology, where you first sort and understand information and fact check it. And that applies to all of our sectors, whether it's about voting, whether it's about, public safety, whether it's about public health, teaching the public and teaching young students to really understand how to consume information, I think is so important. And then I know one example I have about radical transparency that worked really well is we had due to climate change, we had a really intense adverse weather event of an atmospheric river, and we were facing a gas shortage in British Columbia. And, they had to mobilize public health because we thought we might run out of gas for ambulances and our own, police, et cetera. And we were rationing gas and figuring out what we were going to do. And I was like picturing the worst, because I'm a plan for the worst, hope for the best kind of person. And we were like, there's going to be riots at the gas station. It's going to be awful. And the original press conference getting pushed back and pushed back and pushed back. And then eventually, and a really smart behavioral scientist and comms person was like, let's tell the truth. Let's tell the public that this is happening, but let's appeal to their better angels. And let's ask them if they can do what they did during the pandemic, work from home. Let's ask them if they can ride their bike or if they can walk. And let's tell them we might run out of gas for police and ambulances unless we all do this together. And it was incredible. There was no lineups at the pump except for a few. Everyone just went back into their work from home protocols, and like 48 hours later, we sort of got some more gas. But it was just amazing, and I think about that all the time. Like, what is the equivalent that we can do? Can we just tell the truth and appeal to people's better angels?
Yeah, I mean, yes, that seems obvious though, no? I would say, in elections management, it's always important, and what we all work at, across Canada is about being measured and principled in the approach we do to change, to everything that we do. They're also, south of the border, the notion of independence is not the same as in Canada. So all of the CEOs across Canada are independent officers of the legislature. They are hired differently. They're not elected, all of those kinds of things. We are terrible at getting our own messages out about who we are and what we do. So that's really an important factor. I think that the way we do our business is always kind of a bit like the librarians, because we need to make sure that we are thoughtful in the approach that we do. We can't just, make a judgment. We have to think about it. And just a small example from when we did the recounts. We did 2 recounts in Ontario, and we hadn't seen a recount in Ontario since 2014. But this one was very different. And to be at the center of it was incredibly eye-opening, because you're seeing the back-end processes, at work. And we have to hand count in Ontario. You can't feed it back through a tabulator. You have to hand count every ballot. So in one of the places, we hand counted 39,000 ballots because they had a difference between the first and the second of 20 votes. So it was judicial recount. And I got to say, opening up 39,000 ballots and going through, I think it was almost 167 disputed ballots between the political entities, the lawyers, which were passionate about every vote. So when people say my vote doesn't count, every vote counted. And at the end result was, because the judge makes the decision on voter intent, 4 votes. So instead of 20, it was 24. And in our other jurisdiction, it was an 8-vote separation, and the difference was 9. So that's that's confidence in the process, right? So I leave you with that.
Absolutely. And Meaghan, your point, and Lalitha, yours as well, really strengthens this notion for me that as much as we talk about trust in institutions and how we preserve it, how we enhance it, there is also a reverse flow of trust, right? Trust on behalf of the institutions in the population so that type of radical transparency can take place. And of course, it's not without risk. I don't think anyone would naively say that the transparency that sometimes our citizens would like to hear from that institutions will be accepted and welcomed. However, I think it's a very important part of this conversation about enhancing trust. As much as we ask Canadians to trust institutions, whether it's public health, elections, universities, or other institutions, there has to be a reciprocity of trust and a willingness to engage Canadians in terms of telling very complex stories and explaining with sometimes detail that I think we've been trained to think, well, people don't want detail anymore. They want 30-second informational snacks. And as our collaborators on the last panel said, actually, there's really room for long-form communication still. There's really room for this complexity. And so encouraging that two-way informational flow, I think, could go a long way to enhancing trust. We do have a few minutes for questions. If there's any from the audience, I know that Meaghan and Lalitha would welcome the opportunity to share more about their organizational approaches to enhancing trust.
Well, thank you all for your comments today. My name is Michael Boda. I'm the Chief Electoral Officer from Saskatchewan. In terms of that trust number, I've been very cognizant in over 3 elections that I've conducted in Saskatchewan, and I'm very aware that trust can be lost very quickly, and it's very hard to get it back. And I think for a long, long time, we've talked about how we need to be more competent as election administrators. We need to run a better election. But I've heard today about relationships and how important they are. And I have to say during COVID how important it was that the Chief Medical Health Officer of Saskatchewan, I mean, he was a superstar. He's a friend now. We had to build a relationship in order to move forward. So I think those relationships are important, and they take, the entire cycle to develop. But I wonder about communication, and I saw a bit of a difference in communication. Meaghan, you were talking about local officials and how important they were as professionals. But in the context of elections, it does seem to me that it has to be more centralized because we're not dealing with election professionals that are on the ground. But Lalitha, I'd like to ask you the question. You've been around a long time. You're one of our senior election administrators in the country.
Sounds terrible, Michael.
Yeah, well, you're quite young, but you've been around. How important has intentional communication become as part of maintaining trust? We have competency, we have relationships, but how central is it to be intentional about communication at the top levels and at the lower levels in order to maintain that trust?
Yeah, I mean, communication is critical. I mean, I started my career in communications, so my communications team were like connected at the hip. When they see me marching towards their office, they're like closing the door. But right from the top, we are, even though we're a very big province, we have a lot of people, we want to be always connected to what is happening out there. Returning officers aren't spokespeople per se, but if we feel like they have a good voice, they have the knowledge, et cetera, we will work very closely with them because we want that local flavor as well. So intentional communications is critical, and it's very thoughtful. But in our election this time, we had, I was panicked about the storm, like a storm hitting us on election day, what would happen, because Stephen told the story about NWT, and it stays with me in terms of the fires and evacuating, changing the date of an election. So we worked really closely with our partners in emergency management, who repracticed and did a lot of intentional work. What would we say? How would we do this? What would we mobilize? So we do a lot of scenario-based on the communications. But generally speaking, before we even go out in an election, that's the space for us before we hit a writ period to talk about how to get out a vote, how to do this, how to connect, all of that. We didn't really have a chance to do that in this last election because of the timing, but that is critical to us to be really intentional. And I would say our CEO is very good at staying on point, being a very good communicator. He's honest and trustworthy, so that always helps.
Yeah, I love that question. I mean, we often say, like, I can't remember who said it first, trust is earned in drops and lost in buckets is the kind of classic quote, and it's so true. And there can only be one chief, whether it's the chief public health officer or the chief electoral officer. But what I think I'm making the pitch for, as someone that's been a chief of staff, so trust me, I know what it's like when your team goes rogue, is sort of a decentralized comms approach where you've really figured out what are the key questions, what are the key messages, and empowering whatever your team can be with those key messages, and so that they really understand that they know what the myths are and what the rumors are and how to address them. I mean, the other thing I'll make a pitch for is kind of like collective impact models outside of times of crisis. You know, they always have a backbone. So, you know, your team is the backbone. You know what the comms are, what's going on, but you need to work with local community partners. And so we often in public health talk about, you know, data approaches to engagement, and we want to understand what is the community that's got the lowest vaccine coverage. And so given one example during COVID, it was sort of the Black community, fairly small in British Columbia, and we went to Hogan's Alley. Again, they are a like economic housing organization, but they had really galvanized the local Black community around social housing initiatives, and we said to them, could you help us address the COVID vaccine gap, the like unfair and unjust difference between access to the vaccine? What's the listening we need to do? Who are the mobilizers in community? And you can do, you know, political parties have done this for a long time. We work with different faith-based communities, different ethnic communities, and we go to the local leaders who are trusted, whether it's a local imam. And I'm wondering if elections do that. I'm sure you probably do, but if you don't, that's something. Where is disengagement biggest? What are the communities that are least likely to vote? And outside of like what we think of as, you know, wartime, when everything hits, how can you make sure they know how to bring their concerns to you? Are you able to run things in their community, in their local language? I think that's advice that applies across all our sectors.
Thank you. Are there any other questions? One in the back.
My question is going to be a little bit more general. So when you look in cross-country comparisons, which we all brought up, the high-trust societies, what they tend to do, they tend to institutionalize cooperation with civil society. So for example, let's take Denmark. Yeah, it's like a small homogeneous society that definitely helps. But what they often do, they would engage unions and they would engage employer federations that span the entire country to deliver health insurance, unemployment insurance, retraining and whatnot. But when we look at this graph, well, let's be honest, the trust in Canada's civil society isn't the best right now. So in the absence of those non-governmental institutions that bring the whole country together from different backgrounds, from different social class, from different experiences, what can a government agency use as a lever to build this sort of trust and this resilience, but on scale, instead of, for example, like an ad hoc cooperation with this NGO or that NGO? What are the institutional models or organizational models that you think we might have to replace that strong civil society that we unfortunately no longer have?
I mean, it's challenging. We have 11 million eligible electors in Ontario, so talking to 11 million people is like impossible, even if you have big companies, et cetera. But in each electoral district across Ontario, we have microcosms of that happening in those communities. So certainly we look at barriers. Like, there are certain demographics, so we don't have to tell that there's an election happening. They'll figure it out and do it themselves. It's not like we ignore them, but there are other areas that we have to kind of really focus on, and we've really focused on barriers, because if we go after specific demographics, we're skewing the vote, right? Like we're not political, but we can become the story of being political. So what we really look at is, what barriers are you facing? You don't have this information, or you don't have ID. But that crosses many demographics. Students who are at home or not home, they don't have, they're sharing an accommodation, they don't have proof that this is what it is. So we have to think about, well, what ID do they require? If you're Indigenous on a reserve, how do you prove an address? So we work with band chiefs, and we've got to think about those big communities that we work with. So it is complex. Do we get everywhere all the time? No, but it is something that we're constantly thinking about and shaping.
Meaghan, did you want to add to that?
Yeah, I think it's just back to the sort of collapse of civil society. My family is Catholic. They came from Ireland, and the church was a big part of our lives. And there's lots of scholars writing about sort of the gap that's been left around faith-based communities and what are kids participating in these days, or whether it's the organizations where people were, like the Lions Club in BC was a big thing, and nobody's a member. What are people members of? And I think political parties have sort of played. If you've worked on campaigns, it does feel like a family. You're organizing your grassroots, and what's a nonpartisan version of that? I think if you have the answer to that, you can write a ticket and sell it to us all. But I just think, again, it's about being in community, and that's what I love about gatherings like this, where we get to solve that problem. I think it's a huge problem, and I don't disagree with you. I wish I had an answer. Maybe Andrea has one.
No, I'm just thinking back to our lunchtime or post-lunchtime keynote, and that idea of figuring out what institutions are emerging as the new touch points for citizens, and they might not be the historical ones, and they might not be as centralized as we've historically envision them, like churches or unions. But I would also point out that, for a long time, I think organizations like unions were being somewhat written off as, they existed and they had previously been very politically active, but were becoming less so, or that political activism was becoming more variable. But in this most recent election cycle, we saw actually a strong resurgence of very expressed statements made by private sector unions about their political preferences that I think surprised a lot of people. So I don't think even the traditional organizations are no longer sites of political engagement and contestation. I think they're really important ones, and I think what they're waiting for a lot of times is the outreach, because as we heard from our colleague from Unifor earlier today, there's a lot of internal work going on. And so now it's about making those connections between the institutions of government or the institutions of the civil service and these community groups, instead of just assuming that, well, they don't function the same way as they did 25 years ago, so we can't use the same strategies. We can't use the same strategies. But I as somebody who spends a lot of time learning about the political inclinations of 19, 20, and 21-year-olds. I am somebody who is very optimistic about the way that the younger generations are seeing how they can be included in politics and how they can perhaps correct some of those imbalances that have been created over the last 10, 15 years. This idea that youth are pulling back from politics, this is not what I'm seeing. And of course I see a selection of university students and high school students, but I think we can't write off some of those core institutions just yet. I think it really depends on how we choose to engage, and our friends on the earlier panel gave, I think, some novel ideas on how to do that. And I think that brings to a close the panel for today. So I'd like to thank my co-panelists, Lalitha, Flach, Meaghan Thurman, thank you so much.